There are three compartments of the leg, and they are the anterior, lateral, and posterior compartments. They are separated by the anterior and posterior intramuscular septa and the interosseous membrane, which connects the tibia and fibula. The posterior compartment is further divided into superficial and deep subcompartments. They are separated by the transverse intramuscular septum. To better visualize these muscles, we'll take a look at a 3D figure now. We'll start at the anterior compartment, also known as the dorsiflexor compartment, where we'll see four muscles that are all innervated by the deep fibular nerve. So here's the tibialis anterior, and it dorsiflexes and inverts the ankle. Next is the extensor hallucis longus, and it dorsiflexes the ankle and extends the great toe. And then here is the extensor digitorum longus, which also dorsiflexes the ankle and extends toes 2 through 5. Lastly is the fibularis tertius, which dorsiflexes and everts the ankle. Next is the lateral compartment, also known as the everter compartment, and has two muscles, the fibularis longus and the fibularis brevis. These muscles are innervated by the superficial fibular nerve, and they evert the foot as well as weakly plantar flex the ankle. Now let's take a look at the posterior compartment, also known as the plantar flexor compartment. All these muscles are innervated by the tibial nerve, and on the right we have the superficial subcompartment, where we can see the gastrocnemius muscle, which flexes the knee joint, and it plantar flexes the ankle when the knee is extended. Next is the soleus, and it plantar flexes the ankle and steadies the leg on the foot. And lastly, for the superficial muscles is the plantaris, which weakly plantar flexes the ankle. Taking a look at the left leg here, we can see the deep subcompartment, and here is the tibialis posterior, and it plantar flexes and inverts the ankle. Medial to that is the flexor digitorum longus, which plantar flexes the ankle and flexes toes 2 through 5. Here's the flexor hallucis longus muscle, and it weakly plantar flexes the ankle as well as flexes the great toe. And lastly is the popliteus muscle, which weakly flexes the knee and unlocks a fully extended knee joint. For sensation to the medial part of the leg, we have the saphenous nerve. Lateral sensation is supplied by the lateral sural cutaneous nerve. On the lower lateral leg is the superficial fibular nerve that also covers the dorsum of the foot. The deep fibular nerve gives sensation to the skin between the great toe and the second digit. The lateral foot is supplied by the lateral dorsal cutaneous nerve. On the posterior side of the leg is the medial sural cutaneous nerve. And for the heel and sole of the foot is the medial calcaneal branch of the tibial nerve and the medial and lateral plantar nerves.